I am Minakshi, Physician Assistant, Max Super Specialty Hospital, Mohali, and my topic is nursing care guidelines to prevent complications in cardiovascular and thoracic surgery. Cardiovascular and thoracic surgery require team efforts in which OPD nurses, OT nurses, operating surgeon, cardiac anesthetist, ICU nurses, perfusionists, and technicians have their own important role to play. Physician assistant plays the important role to bridging the gap between all team members. The role starts from booking of consultation by the patient and pre-operative worker to establish the diagnosis and evaluate the fitness for surgery. It is important to establish the COVID status when antiplatelet drugs stop and patient received loading at the time of angiography. Apart from routine investigations, echocardiography established the left ventricular function, valvular status, RWMA, and pulmonary artery pressures. From top 10 RE levels are done in case of ACS, which helps in planning the urgency of surgery. Physical examination and systemic examination is followed by examination of site of surgery and status of conduits. Allen test for radial and saphenous vein examination in standing position. Once the anesthetist and surgeon find the patient fit to be taken up for surgery, cross-match is sent and screening is done for platelets. All consents are taken, part is prepared, and spirometry is started if patient is hemodynamically stable. It is important to inform the complete status to the operating surgeon prior to surgery, and all team members should meet and discuss the final plan as well as backup plans in case anything goes wrong in the procedure. The physician assistant assists the operating team following all steps of surgery meticulously and shifting the patient safely to ICU after surgery is over. A proper epic handover and takeover of patient with details of status is strictly followed. Inotropic status, drain, bottles, ET tube, and ventilator settings are meticulously checked. There are written guidelines for monitoring and nursing care from day 0 to day 4 and guidelines for medications as well as investigations. The patient is given constant round-the-clock care, and there are clear guidelines when to inform the consultant about progress of the patient routinely and when inform any sudden changes in parameters to be informed urgently. On day 1, the patient is initially ventilated, and if patient is hemodynamically stable and there is no significant post-operative drainage and negligible inotropic support, only the patient is gradually weaned off if there is no other contraindication like acute MI or poor LV function, no acidosis, no rising lactate, no fall in urine output, good ABG, and good neurological and good muscle power. The patient fulfills the extubation guidelines. Patient is weaned off the ventilator after making sure there is appropriate backup in case of patient is re-intubated. We remove the PA catheter when the anatropsy stops. On day 2, the patient is mobilized and normal diet is started. On day 3, Foley's catheter removed, can switch over to oral medication, and if everything is okay, plan for discharge after removal the pacing valve. There is written guidelines and checklist for assessing the patient fitness for discharge. Patient relatives and also patient are clearly counseled about guidelines to be followed, and patient is sent to home or to rehabilitation center according to our scoring criteria. Patient is given a printed treatment plan along with dietary advice. Follow-ups should be first visit after 7 days, second follow-up after 1 month, and a third follow-up is after 3 months. In thoracic patients, there are strict guidelines for care of ICD. Apical ICD is removed when there is no air leak, and basal ICD is removed when there is no drainage and lung is fully expanded. Standard protocols are followed to prevent infection, DVT, bed sores, and accidental falls. Conclusion. With clear routine, perioperative guidelines, and appropriate backup plans, patient can have an uneventful outcome from surgery. Team effort improves surgical outcome drastically, and by avoiding complications, lowers the cost of procedure and reduces length of ICU and hospital stay. Thank you.